There are probably four most common procedures that we see in the office. The bunion deformity, which is the deviation of the big toe and the big bump on the inside of the foot. The hammer toe deformity, which is the curvature and the flexion deformity of the toe. Heel pain, which people develop over time from overuse type syndromes. And then flat foot deformities, where the foot is flattened out, the arch collapses, and people get, the patient gets pain in the arch, gets pain on the ankle joint. The most common problems we see really are things that most people can see and identify themselves, and usually they come into the office and say, I've got the bunion, I've got the hammer toe, I've got heel pain, and they really do self-diagnose themselves. Makes my job a lot easier because most of the time people say, can you fix this particular problem? And we have great techniques that we use to fix these problems. Bunion deformities we've developed and evolved over the years. We've corrected bunions with different types of fixation. Now we're using a certain type of fixation where in my practice we try to keep the patient active throughout the healing phase. I'm very conscious of the fact that a lot of people like to exercise, a lot of people like to work out, a lot of people need to keep working because, need to keep going because they work. These things are very, so we develop procedures that allow people to keep working and keep in their activity level up. Different types of fixations, internal fixation, nobody sees any hardware, all the hardware is buried. The type of fixation is very firm, very stable. It allows people to walk on their foot while they're healing most of the time after surgery. The bunion procedure is a fantastic procedure. The results now are very predictable the way we do them. The outcomes are very predictable the way we do the bunionectomies. And the same thing with hammer toes. Hammer toe deformities develop over time where the toe contracts, the lesser toes contracts, the second, third, fourth, and fifth toes contract. And when they contract, the top of the toe rubs against the shoe, becomes painful, becomes uncomfortable, and it develops a little callus on top. So what we've developed over the years is a procedure where we put a small device within the toe that keeps the toe straight once the procedure has been done and allows the toe to heal in a straight position with no external wire sticking out. The heel pain is another very common deformity that we see. Heel pain is typically an overuse type of condition where the ligament on the bottom of the foot called the plantar fascia becomes somewhat degenerated at its point of attachment to the heel bone and develops pain at that point. We have lots of different techniques that we use to treat that, starting with the most conservative treatments of over-the-counter orthotics, anti-inflammatory medication, stretching exercises. Then we go to a little bit more invasive type treatment for it if you don't respond to those conservative treatments with a cortisone injection. Very often that will alleviate all the pain. Cortisone injections are very safe if you give one or two and no more than that. And if that fails, then we have things like extracorporeal shockwave treatment, which has been very effective in treating plantar fasciitis. We also use platelet-rich plasma injections, which have been very effective in treating plantar fasciitis. And if that fails, we use an endoscopic procedure that releases some of the part of the ligament that relieves the pain on the bottom of the heel. So we have a host of things that we're doing for plantar fasciitis.